Hello everyone. In this video we are going to see about orbital cellulitis. The name itself is self-explanatory. Orbital cellulitis. So itis means inflammation of the cellular compounds of the orbit. So it is a purulent inflammation of the cellular tissues of the orbit. The most common cause for development is, assuming this at the orbit, extension from the neighboring tissues. So the inflammation gets extended from the neighboring tissues into the orbit, especially from the nasal sinuses. This is the most important cause, and there could be another causes like deep injuries in which there are retained foreign bodies. Also due to septic operations, posterior extension of suppurator infections from the eyelid eyeball. So the inflammation is present in the eyelid, it could pass back into the orbit and cause orbital cellulitis. Or it could be due to facial erysipelas. So this thing is the bacterial infection which affects the facial skin alone, and it causes bright red tender rashes. Bright red rashes. So here you can see this is a red rash, bright red rash caused by the bacteria. And other causes could be due to metastasis in pyema. Pyemia. So pyemia means blood poisoning actually. So in septicemia, the pursuing bacteria could be in the blood and it could metastasis to the orbit, causing inflammations. And here we are seeing important topic, orbital septum. So orbital septum, it is a fibrous layer which is present between the eyelids and the orbit. So it is a fibrous layer that separates the eyelids from the orbit. So here in this image, we can see the orbital septum, which I am highlighting in the yellow. So it separates the eyelids from rest of the orbit. So this orbital septum is used to classify the cellulitis. So classification, cellulitis into preseptal, so inflammation before the septum, and postseptal. So it is also called as orbital cellulitis. So preseptal, inflammation of structures anterior to the orbital septum. Inflammation of structures just behind the orbital septum. So orbital cellulitis may also involve the eyelids also. So first coming to the preseptal cellulitis. So it presents as a swelling of eyelids. So with erythema and chemosis. So chemosis means swelling of the membranes. So accompanied with this, there's always an conjunctival discharge. And other things like proptosis, which is like exophthalmos when the eye protrudes out, then restricted movements, or any visual impairments. All these things are not seen in preseptal cellulitis, which could be seen in orbital cellulitis actually. So coming to the treatment part, as this is an inflammation before the septum, it is curable spontaneously by antibiotics and NSAIDs. So resolution is generally quick and complete. So there will be complete resolution. In this picture we could see the preseptal cellulitis. There is erythema and chemosis present. And there will be a spontaneous resolution when antibiotics and NSAIDs are given. Now coming to the orbital cellulitis. So this is the inflammation present anterior to the posterior to the orbital septum. So it involves the orbit. So even in this thing there could be swelling of eyelids which will spread to the orbital segment. So proptosis. In preseptal there was no proptosis, but in orbital proptosis may be seen. And mobility is also impaired. And diplopia, double vision is seen. Then pain and fever is also seen. And there could be cerebral symptoms sometimes. So, and vision is also impaired. So all these things are seen in orbital cellulitis, which was not seen in preseptal cellulitis. So explaining one by one. Proptosis. So it is exophthalmos, so the eye appears protruded. Then diplopia. So diplopia, double vision, it is due to the mobility impaired. So mobility is impaired, so it causes double vision. So pain will be severe actually, and it will increase when you try to move the eye or external pressure is given. Vision reduction. So vision reduction in orbital cellulitis is seen due to two reasons. So firstly, retrobulbar neuritis. So inflammation of neurons behind the bulbar area or compression of the optic nerve. So as there is inflammation, the size of the orbit increases and it pushes or compresses the optic nerve, or it could compress the blood vessels at the apex of the orbit. So compressing blood vessel or compressing the optic nerve could be the reason for visual reduction. And this compression occurs due to raised tissue pressure. Due to the inflammation seen, and it causes edema also. So inflammatory edema occurs in three structures, mainly extraocular muscles, orbital fat, and congested veins. So now coming to the examination. So examination, when you try to examine the fundus, it will be much difficult to examine due to the inflammation, and then fundus may show engorgement of veins. Or optic neuritis, already seen. And later it may progress to optic atrophy. An abscess may be formed and usually points somewhere in the skin of the eyelids near the orbital margin and may empty into the conjunctival fornices. So if it is severe, it could cause cerebral symptoms also. So the mechanism of orbital cellulitis causing cerebral symptom is, this thing may happen in severe cases and due to pan-ophthalmitis. So inflammation of the complete optical structures, and inflammation may pass on to the brain and the meninges. So resulting in purulent meningitis, cerebral abscess or thrombosis of cavernous sinus. Thrombosis of cerebral cavernous sinus is the most severe form of ophthalmitis, orbital cellulitis. So, as it is an inflammation, organism could be isolated from the inflammation on the first cells. The most frequently seen are staph and streptococcus species. And even Haemophilus influenza, Pseudomonas could be seen. And sometimes Escherichia coli is also seen. These are normal people, and if the patient is diabetic, then mucor, aspergillus infections are also possible. And in order to grade this inflammation, there is modified Chandler's staging system. Modified Chandler's staging system. So it is divided into 5 stages. Stage 1, It is based upon the extent of involvement. So firstly, preseptal cellulitis. So only the part before the septum is involved, inflammation. Then inflammatory orbital edema. So edema is also present along with inflammation. Then subperiosteal abscess. So there will be abscess formation in subperiosteal areas. Then stage 4, orbital abscess. So abscess is completely in the orbit. Then lastly, cavernous sinus involvement. So in panophthalmitis, then it enter the brain and meninges, then may enter the thrombosis of cavernous sinus. So treatment. Before giving treatment, we should take the blood culture for identifying the organisms. Because after giving antibiotics, the organism may not be seen. So after that, then we should infuse IV broad spectrum antibiotics. As it is a serious condition, we are giving it in IV. And along with NSAIDs. If it is treated early, then even in this condition, the resolution could be spontaneous. And in examination, we can examine the extent of infection by a CT or MRI. So using CT MRI, we can see the soft tissue involvement. And if there is a localized abscess, then we should prolong the therapy for a long time, and we should also drain the pus. So in this picture, this is a diabetic patient is suffering from orbital cellulitis. There is inflammation of eyelids also. So in this the CT, this is a CT, and we could see the soft tissue involvement, which could be used to assess the extent of infection. So reversing from the front, orbital cellulitis. It is a purulent inflammation of the cellular tissues of the orbit. And the most common cause could be extension of inflammation to the neighboring parts, so especially from nasal sinuses. And the least common cause could be due to deep injuries with retained foreign bodies, or due to septic operations. It could be due to posterior extension of supurated inflammation from eyelids or eyeball. Then it could be also due to facial erysipelas. It is a bacteria which causes bright red rashes on the skin, on the facial skin. And metastasis in pyema. So pyema is blood poisoning, so it is septicemia. Orbital septum. So it is a fibrous layer that separates the eyelids from the orbit. So in this image, this thing is the orbital septum. And based on orbital septum, we are dividing into two things, preseptal and orbital cellulitis. So preseptal, which involves the things that are anterior, and orbital, which involves the things that are posterior to it. Preseptal involves eyelids and cause erythema and chemosis, which is a swelling of membranes. And conjunctival discharge is seen in preseptal, but proptosis, restriction of ocular movements, visual function impairment is not seen. And in treatment, antibiotics and NSAIDs can work. It will be quick and be complete treatment. In this picture, we can see the preseptal cellulitis. Coming to orbital cellulitis, extends swelling of eyelids and also cause chemosis. And here, proptosis, mobility impairment, diplopia, pain, fever and cerebral symptoms, and also vision reduction is seen. which is not seen in preseptal cellulitis. And explaining each in detail, proptosis, it is exophthalmos seen, and diplopia is due to mobility impairment, and pain, it will be severe kind of pain which increases on movement or pressure. Vision reduction, it could be due to two reasons mainly, due to retrobulbar neuritis or compression of blood vessels at the apex of orbit, and it could be due to compression of optic nerve also. And these two compressions are due to raised tissue pressure, which is due to inflammatory edema seen in these three structures: extraocular muscles, orbital fat, and congested veins. So examination is difficult, and it may show engorgement of veins and optic neuritis, which later get converted into optic atrophy. Then abscess could be formed at the skin of eyelids, and it will empty into the conjunctival fornices. Cerebral symptoms, which may happen sometimes: panophthalmitis, which will spread to brain and meninges. It can cause purulent meningitis, cerebral abscess, and thrombosis of cavernous sinus. It is important in staging of the orbital cellulitis. Organisms involved: Staph aureus or Streptococcus species. Haemophilus influenza may be seen. Pseudomonas E. coli could be also be seen. In diabetics, Mucor and Aspergillus is possible. Modified channeler staging system. So divided into 5 stages: preseptal, inflammatory orbital edema, subperiosteal abscess, orbital abscess, and finally cavernous sinus thrombosis. And treatment for orbital cellulitis. So before treatment, we should take the blood sample to find the organism involved. And treatment: IV broad spectrum antibiotics with NSAIDs. If done early, so resolution may be rapidly seen. And CT to find the extent of involvement. If localized abscess is present, we should drain the abscess. And this picture, that is a diabetic patient, and we can see the CT for the soft tissue involvement. So thank you for watching. Goodbye.